It's my pleasure to kick off today's first session, Exercise with pH. This is a 30-minute session with about 15 minutes at the end for Q&A. Our moderator today is Lenice Whitley, great gal. I'm a huge fan of Lenice. There she is. She's a pH patient out there in Manhattan. Lovely smile. So let me turn it over now to Dr. Greenspan and Lenice. And for your safety, all names, voices, and likenesses have been changed to protect the innocent. Dr. Greenspan, welcome, and thank you for joining us today.
Good morning, everybody. Lenice, good to see you. Thank you, Carl. Good to see you. I don't know if you remember, we met on the rooftop in New York City one night. Chloe has been my patient for a very, very long time. I want to talk very quickly today, which I will talk quickly because I do talk quickly and I'm limited for time. But I'm going to try to make a 15-minute presentation and then leave it 30 minutes of Q&A. So I want to have very much be able to have each person here leave with information that they can start using right away. So the reason why I show you this is because exercise is just one part of the things that or just one part of the puzzle that I think really helps people to live their best lives possible. And I have a concept called ultimate pulmonary wellness, which these are the things that over and over again over the years, I've found to be the big ticket items as far as getting the most bang for your buck. Like we're all looking for that silver bullet. We all want to go into the back aisle of Kmart or Walmart or wherever you shop and find that little piece or that device or that pill or that supplement that's going to cure all our problems. But it's really a basic simple formula if you can follow it. So the 5 things that I've found the most important over the years are as follows. Number 1, medical. And what I consider to be medical are to be having the right doctors, having the right medical team, having the right medications and treatment protocols in place, and then taking those medications properly and following those protocols. So in the US especially, I think that the majority of us have come in contact in a lot of situations where medical is like 90% of the puzzle. And then on the way out the door, somebody says, hey, you know what? Get a little more exercise, watch what you eat a little bit, and hey, relax, take a vacation, et cetera, et cetera. But I think that medical is super important, but I think that these other things are equally important. And I'll explain where I got that 18% from in a little while. Now, granted, there's going to be times when medical is the most important. There's going to be times when you're medically stable and exercise will be the most important. Or if you're 50 pounds overweight or 50 pounds underweight, then nutrition might take a bigger role there. But these are the big 5 as I see them. Exercise, crucial, and that's what I'm going to talk about today. And again, it's doing the right exercise, doing it properly. Nutrition, crucial, okay? You have to be well nourished, but you want to make sure that you're not underweight, that you're not overweight, because all these things contribute to our overall wellness. And then stress, anxiety, depression, emotional health, all this stuff is crucial because, a lot of times I see patients who, are diagnosed with pulmonary hypertension, are diagnosed with COPD, or diagnosed with pulmonary fibrosis, or diagnosed with COVID. And I often say if they weren't stressed, if they weren't anxious, I would be more concerned about them. So any condition in which the key elements are shortness of breath, chest pain, the inability to walk to the bathroom without, knowing if you're going to pass out, it's very stressful and very anxiety provoking. And over time, this can be depressing. But one of the things that's really important is that very often when we are diagnosed with a condition, or we start to develop a symptom, we make adaptations to that diagnosis and we make adaptations to those symptoms. So as just one example, when people start to get short of breath, they find ways to avoid the activities that cause them shortness of breath, or they find ways to avoid the activities that cause them chest pain. Or if we go in another route, if you have a bad hip, you find ways to avoid the activities that cause you hip and back pain. And the problem is that your body gets good at doing what you ask it to do. So if you ask it to sit on the couch, flip the remote, and eat potato chips, that's what you get good at doing. And if you ask it to start getting it back into action, even if it's small steps forward, well, that's what it gets good at doing too. And one thing is that very often when people are diagnosed with a chronic illness, they often become these kind of black and white, monochromatic, kind of unifocal or unidimensional versions of their former selves that is focused on getting up in the morning, taking your medication, going to the doctor, going to the pharmacy, taking your medications, et cetera, et cetera, et cetera, but that are completely devoid of any type of art, music, fashion, sports, color. And those are the things that make up our lives. And one thing I'm here to tell you is that very often, okay, I would say in almost every situation, at least for a period of time, all the things in the same way that we can start to spiral downhill or snowball downhill, if we start to make some of these changes in the opposite direction, we can start to snowball up the hill again too. And so momentum is often very much a major power here. So they say game recognizes game, or birds of a feather flock together. And if we start to make these positive changes, then we can start working our way back up the ladder. A lot of times we think in terms of black and white, all or nothing thinking. And it's like, okay, you were diagnosed with this, which means you have this much time to live and you're just going to get more short of breath and then you're going to die. And to me, that is one of the worst things you could ever say to a patient, because number one, you never know. I've seen so many patients kind of beat the odds. And the most important thing that we have, and the most important thing you can take away from a patient, is hope. Once you lose that hope, and so I love to hear the term phenomenal hope, because hope is everything. And without that, then, all is lost. So don't give up no matter what. If you don't find the answer in one place, find it in other places. Keep looking. Prevention of infection is crucial. And I think that at no other time in our history did prevention of infection come in more so than the last year. And I will say one thing that I'm really happy about is that almost none of my patients got COVID. And that includes the oldest, sickest patients in the book, because my specialty is cardiovascular, pulmonary, and complex medical patient. And the reason why I think so many of our patients did so well is because we have been preparing for this day for decades and teaching our patients about this for decades, because all the same things that prevent COVID prevent pneumonia and prevent the common cold and prevent the flu. So, we were really ahead of the game and a lot wiser than a lot of the people at the beginning of this, and unfortunately a lot wiser than some of the people at this moment in time. So the reason why everything else has such a wide range is because you could do all these things right. You could get the right doctors, take the right medicines, you can exercise, you can eat right, you can manage your stress, anxiety, and wash your hands 100 times a day. But if you step off the curb and twist your ankle, well, that's going to play a big role in what you do. So everything is variable. Those are not exact, and they're going to be fluid over time. So this is a little Alfred E. Neuman quote here: "What me exercise." And the reason why it says it in this way is because so often when somebody's short of breath, when somebody is experiencing chest pain, when somebody is, can't get out of bed or can't walk across the room or can't walk up the hill or the stairs or work or are fatigued, the last thing that you can think about, or the last thing that you want to think about, is exercising. But what I'm here to tell you is that no matter how sick you are, no matter how acute your illness at the moment, you still can and you still should under the right conditions. And those are the things that I want to talk about today. The big problem, okay, and we recognize that, breathing is multifactorial. There's a lot of things that come into place, but when it comes to pH, when it comes to other conditions along this area, the big problem is shortness of breath, or as I like to call them, that miserable SOB, okay? And shortness of breath is terrifying. So I hate to say this because I love sharks, but unless you're getting attacked by a shark or chased by a shark or a bear, there are few sensations in life that are as terrifying and that want to make you throw your packages in the air and get the heck out of there than shortness of breath. So this is one of the things. It's an example of one of my patients walking up the stairs, and this is that miserable SOB saying, "Where is your hero now? Where's your hero lung man now?" And she's saying, "Help, I can't breathe." And back here, down at the train, someone's saying, "That miserable SOB." And then Lungman shows up and Lungman says, I'm right here, you SOB. And he says, Lungman, where did you come from? He says, never mind that. Put this nice lady down and nobody gets hurt. And the patient says, oh my God, I'm going to die. But she didn't die. And one thing you'll notice is that she's walking and doing these things with her oxygen, okay, which is something that's really important for a lot of our patients. So as I alluded to before, breathing is multifactorial. And what I mean by that is that there are many, many factors that are involved in how well or how poorly we breathe. So a lot of times, obviously, the lungs are involved, right? And the heart is involved, okay? But most people don't think heart first. Most people think lungs and heart. But how our body utilizes oxygen is really based on three big factors. And those big factors are how well your lungs move air in and out and diffuse, how good is your heart at pumping blood, and how efficient are your muscles at using oxygen. All three get better with activity. All three get worse with inactivity. But then if we take away the physiologic, it could be, hey, guess what? I haven't exercised in 2 years. It could be, hey, you know what? I put on 50 pounds over the winter around my midsection, and now that basketball and everyone thinks I'm pregnant, and hey, that's pulling down on my lungs. So there's a lot of things that play roles in this. It's not absolute and it's not black and white. So it's really important that every single patient that we see is evaluated as just that, an individual, and evaluated, not assumptions made, but finding out the real reason why somebody is short of breath. Because whether it's being out of shape, whether it's your pH, whether it's your other factors, whether you have pneumonia, you're only going to be as good as your most limiting factor. So once we figure out what that most limiting factor is, then by all means, that's the one we go at full force. And when we talk about pH, pH is other factorial, which means that it's not just these basics. There's a whole bunch of other things that come into play with respect to medications, with respect to getting to and fro, with respect to the potential for being involved in a surgical team. You name it, you guys could make this list 100 times more than I can make this list. But keep in mind that it's not a simple solution. And very often, we didn't get into this whole overnight, but we're not going to get out of this all overnight. But the thing is that when we come, a lot of times, it's like I always say, like the little kid who comes and his fishing pole is all tangled up. Once we start to untangle these threads and kind of figure out what's doing what, then we can hit them one at a time. So here's the solution. So when it comes to exercise, and again, I'm racing through my slides because I want to get to questions and give you an opportunity to speak, but there's 4 basic things that we can change about exercise or to develop what we call an exercise prescription. And it's listed here as FIT, which is frequency, intensity, type, and time. I've rearranged them here so they make the most sense. When we talk about the type of exercise or the mode of exercise, there are many different kinds. So we talk about cardio, we talk about strength training, we talk about yoga, Pilates, Tai Chi, Qigong, fencing, et cetera, et cetera, et cetera, et cetera. But there's a lot of different types of exercise that we can engage in. And, you know, they all do different things. And we want to find something that's going to be the most beneficial for you, that's going to give you the most bang for your buck. But most importantly, that's the one that you're going to do. So people say, well, what's the best exercise? And it's always the one that you want to do, okay? Or the one that you will actually do. Because I got news for you. It's not that you have to have an Olympic level crusade. You don't have to bike 2,742 miles. What you have to do is you have to do something every day. And Nike says, just do it. A lot of times in forums like this, we say, well, what is it? And I say, well, just do something. In terms of the frequency of exercise, you should do something every day in most cases, but it doesn't mean you have to go to the gym. It doesn't mean you have to hop on the bike or the treadmill, et cetera, et cetera, et cetera. It just means don't let time go by where you're just sitting like a statue. And if you think of your body, not just the muscles, not just the bones, not just the tendons and the ligaments, but all of the systems, the cardiovascular system, the respiratory system, the endocrine system, the neurologic system, think of them as wax that we want to keep warm and we want to keep malleable and we want to keep moving in the right direction. So there should be, you know, some kind of activity every day. However, again, this is going to be individualized. So we don't want to overdo it and we don't want to underdo it. We want to follow the Goldilocks method of exercise, which is we want it to be just right. But again, there's not going to be one program that's going to be just right for everybody. So it's important to, number one, be evaluated and worked up for any things that could be dangerous in order to make sure that you're safe to exercise, and then to be evaluated to determine which exercise is going to be the best for you, how often you should do it, how long you should do it, and how hard you should do it. Now, in terms of time, okay, a lot of people say, well, you know what, I can't walk for a minute, okay? Well, that's okay. If you can't walk for a minute, walk for 30 seconds and then do it again, and then do it again, and then do it again. We have a 42-day program, which is called Pulmonary Wellness Boot Camp, and it's a free program. It's a 42-day program, and it starts at 4 minutes of walking in place. So, and what I say in the first day is, I say, if you can't do 4 minutes, do 2 minutes and 2 minutes. If you can't do 2 minutes, do 1 minute and 1 minute. You know, and little by little by little, you can build this up. If you could walk a minute today, you could walk a minute and a half tomorrow. But a lot of times it's undoing and overcoming the inertia and just getting the car moving. And then intensity is kind of the big question that people have, because everybody feels like, you know, I don't want to overdo it. I don't want to get short of breath. I don't want to get chest pain. I don't want to have a heart attack. And unfortunately, a lot of people, when they think about exercise or when we mention treadmill, their only thought is of that time when they, quote, failed the stress test, right? When they got on the treadmill and the next thing they knew, the team was putting them in a chair, et cetera, et cetera, et cetera. But the fact of the matter is that the stress tests and the exercise tests that most people do are actually too vigorous and the wrong tests for people with PH. And we can talk about that at another time when you have another 2 hours. Breathing is very important, okay? And breathing is important because one of the first symptoms of PH and a lot of the other conditions that I treat is shortness of breath. So many people know about pursed lip breathing, and what pursed lip breathing does is it creates a back pressure and helps us to get air back into our lungs and helps keep the airways open and help keep the alveoli open, to give you greater control of your breathing, right? Diaphragmatic breathing is when we focus on using the diaphragm, but let me tell you a secret, all breathing is diaphragmatic breathing. So you can't take a breath without your diaphragm contracting, which is the main muscle of respiration. Paced breathing is when we time our breathing with the activity. So it's like you wouldn't take a 200-mile car ride and then fill up your tank. You have to fill up your tank, and then as you use the gas, you fill up again, or as you drive, you put in more gas. Same thing with breathing. A lot of us find that when we walk up a flight of stairs or walk up a hill, we're okay while we're doing it. But when we get to that top of the hill, that's when we have to stop, and we're like, oh my God, what happened? I'm never doing it again. And I always think of you know, Fred Sanford when he's like, Elizabeth, I think it's the big one. And you know, the thing is that if you don't know how to swim, you're not going in the pool, right? And you know, it's understandable that if you're not sure if you can make it to the grocery store or back, well, then you're probably not going to do it. If you're not sure if you can swim, you're not going in the pool. And if you don't know if you're going to be able to walk without getting chest pain or being able to catch your breath or passing out or having a heart attack, then you're not going to be able to do it. So really, education about what is actually happening is crucial. So teaching our patients, when is it okay to be short of breath, how much shortness of breath is okay, and then what can we do to do it? You know, what can we do to do these activities while maintaining more control of our breathing? And then positions for recovery from shortness of breath, because there are positions that will put you in place so that your respiratory mechanics are improved, so that your diaphragm has the greatest mechanical advantage, and so that you can recover more quickly and effectively. So the idea is, again, if you feel like you have no control, you're not going to do it. If you feel like, hey, wait a second, stop, I know what to do here, then you're going to be willing to take the first step. Now, one thing to keep in mind here, these are not the exercises themselves. So a lot of times I hear about people in pulmonary rehab programs or other type of breathing programs where they say, you know what, just do 10 minutes of pursed lip breathing a day or 10 minutes of diaphragmatic breathing a day. And the fact of the matter is you can do that until the cows come home, but you're not going to get better at walking. So these are tools. These are like a bridge that get us across, that grease the wheels, that lubricate the system so that we can do these things. The main type of exercise that is going to be the most effective for people with any type of cardiopulmonary disease is going to be cardiovascular or cardio or aerobic exercise. And these are things like treadmill, bike, upright or recumbent bike, upper body ergometer, which is this, new step, elliptical. And when I talk about walkabouts and arms up, these are things that we do in our center, and these are things that we do as part of our program boot camp. And you don't need any type of equipment for any of these things. You don't need anything other than your body and a timer and the ability to just be willing to start this. So I want to just show you an example. Now imagine this is what we call a walkabout and arms up, and you can do these things walking in place. Okay, so if you want to do it on a treadmill, you do it on a treadmill. If you want to do it walking in place, you can do it walking in place. But essentially the idea behind this was we shot this footage all over the world, and the idea is for you to be able to imagine yourself on a virtual walk in these various places, because God knows that if the exercise is not at least a little bit interesting and fun, then it's going to be boring. So this is walkabouts and arms up, and it's only love.
Okay, the reason why we call it a walkabout is because you're going to see our walkabouts through different parts of the world, because I'm sure the last thing you want to see is me walking in place for 15 minutes. We're going to give you access to beautiful scenery. To beautiful landscape, to nature, to animals. To make you really appreciate things. To recognize that you are alive, okay? You are not this disease. Why is it so important to do upper body aerobic exercise? When people have difficulty breathing, or they have a respiratory issue, or they have some type of dysfunction of their cardiopulmonary system, upper body exercise is particularly difficult for them, because it puts the respiratory muscles at a very poor mechanical advantage. So it's very important that we train those muscles so that they get stronger, they become more flexible, the thorax becomes more flexible, and they become better at using oxygen. So today is the first day of arms up. Arms up.
All right, so you can see that does not take anything, okay? So these are things like climb the mountain, marching soldier, pump the tire, and you can make up your own. It could be flap the chicken's wings, but anything that gets you moving is a step in the right direction. This is another portion of boot camp, and just so you know, these are not shameless plugs, okay? Boot camp is free, okay? It's free of charge. You don't have to pay anything. It's my gift to you. But again, breathing, balance activity, flexibility, and strength exercises. But I want to point out something else that's actually something that's going to make you happy, which is the fact that people say, well, what do I need? Do I need cardio or strength? Do I need strength or flexibility? Do I need flexibility or balance? The beauty is that when you start to exercise, you get all of these benefits in all of the activities. So when you're walking on a treadmill, you get breathing benefit, you get balance benefit, you get flexibility benefit, you get strength benefit. When you're pushing exercise and weights above your head, you're getting breathing exercise, you're getting balance exercise, you're getting flexibility, strength exercise. And I want to just show you what some of these things look like.
So we wanted to create a program that would support the respiratory system in the best way that we can.
So today I want to sort of go back to the basics.
When you feel like no matter what you do, you cannot catch your breath and panic has set in, these are the times when it's most important to talk to yourself.
And we think exhale. By ridding the body of toxins.
Remind yourself that you know what to do, and remind yourself that you have certain tricks that you can utilize, certain tools in your kit that will help you regain control of your breathing.
And as you lean forward, blow it out.
Our goal is to break into that cycle by, number one, teaching you more effective breathing techniques.
Breathing into the chest. One long breath all the way out. And I want you to breathe in. You want to do this about 4 times.
And number two, teaching you how to exercise so that your body becomes more efficient, stronger, and better at using oxygen.
Inhale. Exhale, send the elbows back.
And then we're going to do both arms together, breathing in. Again, as you get stronger, you can increase the time, and consequently, you become less short of breath.
Here's a question. Do you say yes to life?
Just go in for 2, out for 2.
My one piece of advice to anybody with, whether it be chronic lung disease, kidney disease, heart disease, whatever, as long as you're receiving your optimal treatment, the one thing you've got to do is keep moving.
7. Again, 1, 2, 4, 5, 6, 7.
Be gentle with your tapping if that's what you need.
This week we have something a little bit new for you, something fresh. We got some new moves, we got some new steps, and after that we're going to give you a little bit of a soul train walk, okay?
We don't live to rehab. We rehab so that you can live your life.
Luckily, I work with a team who has no shame and who essentially is ready to do anything on 30 seconds notice. So here's some important things. So when we talk about exercise prescription, okay, there are going to be certain vital signs and certain things that we need to take care of, because first and foremost, the most important thing is safety. Okay, so the last thing we want you to do is say, hey, you know what, today's a great day to go out and exercise, and you get hurt because you're unaware of your parameters. So that's where talking to your doctors, talking to your healthcare team, talking to your rehab team comes in very, very handy. We want to monitor heart rate and rhythm. Not everybody has access to an EKG, obviously, at home, but we can learn a lot about your heart rate, your blood pressure, and your oxygen saturation. And you saw that a lot of people in the videos were wearing oxygen. So there are times where we will use oxygen during exercise with people, even if they don't use oxygen outside in the street. So a lot of people think that the only purpose of utilizing oxygen is to raise your saturation. But oxygen is a bronchodilator, meaning that it opens up your airways. It's a vasodilator, which means it opens up your blood vessels and in fact can actually reduce your pressures. It's a brain feeder. It helps to feed the autonomic nervous system. And what we found over the years is that by supplementing with oxygen, even sometimes in people who don't need it during everyday activities, and increasing oxygen in people who do wear it, we've gotten tremendous results, and we've been able to get really exercise people at very vigorous levels. The other thing to keep in mind is that, you know, some programs will say, okay, your oxygen saturation is low, therefore we're going to lower the exercise in order to meet the demand of the oxygen saturation. But that's like every time a baby cries, you give it a bottle and it never learns to stop crying. And I've heard, I don't know anything about babies. I've heard, and I've seen it on TV. But the idea is that, you know, the body doesn't know you're getting oxygen. The body only knows that it feels better and it's doing better. So by doing that, we're able to allow people to do bigger workouts. And remember before when I said those breathing exercises aren't the exercise, that's the tool, that's the bridge. The oxygen is also not the treatment. The oxygen is the bridge that will allow you to do the exercise, and that exercise is what's going to make your body better and stronger. And the other thing to ask yourself is, how do you feel, right? Like at some point, there was an idea of no pain, no gain, and that is absolutely not what we are promoting. But I'm sure many of you have seen these before. This is the RPE rating of perceived exertion scale and perceived dyspnea or breathlessness scale. You don't even have to know any of these things. Obviously, you don't have to memorize these things, but generally, as a general rule, we want you exercising in the very light. Actually, this is a mistake here. This should say fairly light. This should say fairly mild. I'm glad I noticed that now, not like anybody's watching. I'm glad I noticed it on my own. But the idea is we want you to start working in the fairly light range, and we want you to work into the somewhat hard range. And towards the exercise, we want you working in the hard range at the peak only, okay? Only at the peak for a minute or two, and then start working your way back down to somewhat hard, down to very light, and stop the exercise. So if you think of it like a flight, okay? It's like you're not sitting on the runway and then all of a sudden we go whoosh, 5G, that would be terrible. And same thing, we want a nice smooth takeoff and warm up. We want cruising altitude, and then we want a nice smooth landing. So one thing I ask patients a lot is, and again, this gets confusing because there's so many things, but I say, ask yourself a simple question. Is this exercise fairly light? Is it somewhat hard, or is it hard? We want to avoid very hard, and we want to definitely avoid very, very hard, because that's when, you know, the plane's, you know, sides are starting to push in on you. But the idea is there are ways to do this in a very, very safe way. I'm going to show you one more exercise video, and then I'm going to take questions. The reason I'm showing you this video is because if you're sitting at home and saying, yeah, that sounds nice, but that's not me, I'm going to tell you that the people in these videos are in their 80s, in their 90s. People have COPD and pulmonary hypertension and pulmonary fibrosis. So, you know, there is nobody that cannot at least get started on a gentle exercise program. Very often, doctors send me their patients when everything else, you know, they've tried everything else, or like the patients that are told, you know, you're too sick for rehab, right? Like, too sick for rehab, what does that mean? Go home, wait to die, right? It's like Alfred Hitchcock's Lifeboat, get out of the boat. But everybody can start. Just keep in mind that not everybody started where they did in this video, but we can start you anywhere, or somebody can start you anywhere, and you can always build on that. And one of my favorite sayings is, it doesn't matter how slow you're going, you're still lapping everybody that's sitting on the couch. And my other favorite saying is, don't let the things that you cannot do interfere with the things you can do. And that's John Wooden. So here's one more video, and then I'm gonna take as many questions as I have time for.
We need some Bollywood.
Okay, then change it before towel dry. Towel dry has to be spectacular.
Spectacular, spectacular. Make it louder, Way. Crank it. Let's bother the neighbors. This is going to be an awesome video.
Oh,
hold on. How you feeling, Alan? What'd you say?
I would have said, if you come in before, 30 seconds before, I would have said, fine.
That's what they all say. Take your hands out of your pocket. Act like you're interested. One.
All right, I don't want to take any more time with videos that are all available. But I'm gonna go to questions. Lenice, do we have questions in the chat?
Yes, we do. We have only about 5 minutes. So I'm going to, one of the questions was,
My
do
clock
you
says 9 minutes and 5 seconds, but go ahead.
your clock, yours is wrong. We'll go by mine.
Okay.
Do you recommend looking on the web, such as YouTube, for exercise? Why or why not?
So the answer is a definite maybe. And the reason why I say that is because YouTube has the smartest people on earth making videos and the biggest idiots on earth making videos. Okay, so the YouTube is great. Okay, YouTube is simply a platform, but I think that there's danger in just looking at something that says, hey, pulmonary exercise here, with somebody that doesn't know you, which, you know, again, no disrespect to personal trainers. I've been whooped by many of them, but the idea is that they're not medically trained. So I'd say if there are specific YouTube videos, like for example, there's one person I love. It was the woman who went when the music went da 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 da, and you saw she had these giant guns. That's Donna Wilson from Sloan Kettering Integrative Medicine. She's phenomenal. So if you put up the word, you know, Donna Wilson, she's great, and it's for people of, you know, with medical conditions. I don't know. It looks to me like Langdon reset the clock a little bit while I was talking. But the pulmonary wellness, our program, and of course I'm biased, but we developed it exactly for people with COPD, with pulmonary fibrosis, with pulmonary hypertension, with multiple medical conditions. Keep in mind that your safety is the number one thing. So I mean, the program is right there at pulmonarywellness.org. Again, it's free. There's a million videos and webinars all about these things. You can see I usually don't take lectures of less than 2 hours because I talk a lot, obviously, and I have a lot to say, but there's hundreds of hours of stuff up there. So please feel free to use them. And again, YouTube in itself is not good or bad. You know, YouTube is it's only as good as the video is only as good and as valuable and as safe as the person making it.
Okay, the next question is, a person is saying that they have, when they use oxygen when they're exercising or running. And is there a specific cannula they should be using? I didn't know there were different cannulas. So.
Well, Lenice, that's why you're the moderator. And no, I'm just kidding. So here's the thing. So is that Kevin's question that we're reading?
Yeah,
now?
that's a question.
Okay. So I have to use oxygen on exertion. When I walk on my treadmill, I use 6 liters. So here's a very simple rule, okay? And I wrote 3 papers called Oxygen Manifesto, and there's a video to that, which I will make all these resources available to Team Phenomenal Hope so that they can share them with everybody. But there's a very simple rule. You have to remain saturated. Okay, so that means that if you're on 6 liters of oxygen and you increase the intensity and you go down to 87%, then that means that that 6 liters of oxygen is not adequate for you. And what that means is that when the oxygen is not adequate, your body starts to get nervous. And that's when it starts to say, hey, something's wrong. We better beat our heart faster, stronger. And that's where potential trouble has. Now, here's the caveat. There are things called high flow cannulas. I'm not a fan, okay? I feel that when you are using, so 6 liters per minute is the most you can get benefit from on a regular cannula, okay? After you're using 6 liters, and you can use more than 6 liters. We have people using, like the person you saw running was on 15 liters of oxygen or 10 liters of oxygen. But when you do that, use the mask, because number one, then you don't have this big, you know, not hot, but cool, fiery, dry air going across your nasal passages. and you're going to get more bang for your buck. The concentration of oxygen you'll be getting is higher. Okay. And, you know, a lot of doctors will say, hey, you know what, 2 liters at rest and 4 liters with exertion. And it's just like matter of fact. That's like saying, all right, all the men here, you're going to wear a size 8 shoe, the women size 6, right? It's going to work for some. It's not going to work for everybody, but talk to your doctor about having the ability to make those adjustments in real time. Lenise? Lenise, we only have 241 left. Keep talking, go.
Oops, sorry, I was on mute. I forgot. Stop it. I have one more question, which I wrote down. Somebody had earlier sent. You probably won't see it in the Q&A. And I believe you touched on it, but the question was, how can we calm ourselves down when you really can't breathe? I know for a fact that, you know, lots of times, you know, we're using the emergency inhaler and we're supposed to be shaking it up for like a full minute. But when you really can't breathe, you're struggling.
Right.
So
and
what is it?
And the other thing is that with the inhaler, right? Like you need to get a good breath in. So if you can't breathe, that's not even going to be effective for you. So first thing, it's very, very simple. Okay. First thing is stop what you're doing. Second thing is lean forward. Okay. Lean forward on a desk, lean forward on a chair, lean forward on the wall, put your hands on your knees and lean on them, because when you do that, number one, your abdominal contents fall forward, clearing the way for the diaphragm, and your arms being fixed, you know, that gives your body a greater mechanical advantage. So that's first and foremost. That's in some videos. Lenise, I'm going to just steal this for 1 second. Have you had an online exercise classes available on Zoom when people can work out together at their own pace? Yes, www.pulmonarywellness.org. Why does my bladder let go when I get shortness of breath? Anxiety. What? Anxiety. B, the flow to oxygen is going to be less to the bladder and less control. No, there's no way to adequately express my thanks to you for your work. I discovered your webinars. You're very welcome. My DLCO is 22%, but my resting O2 is 98 to 100%. My exercise DSAT only goes to 96, 97. My PFTs are very severe. I do struggle with exercise, but it varies greatly. I also, okay, so if your diffusion capacity is low, your oxygen saturation is okay though, but your PFTs are very severe. What that's telling you is it's not an oxygen issue, it's a mechanical issue. So when you want to blow out, we have a mechanical obstruction to air and it's making you uncomfortable. The good news is your body is still able to maintain proper saturation.
And you know what? Unfortunately, we're going to have to stop now because we're running out of time.
One more question, Lenise.
No more time. We're done.
Lenise,
but you know what? You have been, you know, Noah, I've known you forever. I've been to your rehab. You have been phenomenal. And,
Lenise,
and people are going to be able to go.
The next time I see you.
And people, and also you'll find out later that you can go to his website. Thank you, Noah. You're phenomenal.
Thanks,
okay,
Dr.
Carl.
Greenspan and Lenise. That was really fun and useful. I'm sure I can use some of those tips to help me on my next Team Phenomenal Hope race.